My name is Nick Sivrich. I'm a physical therapist, and today I want to go over this week's question of the week. This week's question of the week is about the rotator cuff, and people ask me, I have a tear. Am I going to need surgery? And yeah, it's kind of a tricky situation because it all depends on what type of tear it is. So your rotator cuff is based off of your scapula, your shoulder blade. It sits all on the shoulder blade, and there's four muscles. And the four muscles are the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. Okay, those are the names of them. The one that is mainly torn most of the time is the supraspinatus, and it kind of sits up here and it wraps around and connects to the your long bone, your humerus at the head of it. That's mainly where the one that's torn most of the time. So depending on what type of tear you have, sometimes if you have a full tear, a complete tear, I'd say most of the time, if not all the time, you're going to need surgery on that. Unless your function is okay. A lot of times people will come in and they won't be able to raise their arm up. They'll kind of be here. You're not going to be able to function out throughout life like that. And sometimes we'll still do therapy to kind of see if we can gain that back. But most of the time, with a full thickness tear like that, you are going to require surgery. Now there are they're called partial thickness tears, and basically it can be 20% torn, it can be 80% torn, or anywhere in between that. And that's just when, obviously it's not completely torn. Sometimes it tears directly from the bone where it connects, and then sometimes it can tear kind of in the middle of the muscle and not directly off of the bone. So depending on what type of tear you have will determine whether or not you will require surgery, and also your symptoms and your functionality. If you have, I've seen people that have had a full thickness tear that are able to raise their arm completely over their head, and they're okay with that. That their pain levels are down. It just all depends on what type of symptoms you're having. If you have a lot of pain, and if your motion isn't there, if you can't reach behind your back. Strength is a big issue depending on what you do for a living. If you're an older individual, you just want to be able to function throughout your day and at your house and be able to do things like that, and you're able to without much difficulty, then I wouldn't really recommend you getting surgery. But if it's really bothering you and you're unable to function throughout the day and it's just ruining your life, then my suggestion is to obviously have some sessions of physical therapy, see if there's anything that we can do, and if not, then surgery would probably be the last option. But that's sometimes what you have to do. So again, I hope this helped. I hope I'm providing some value for you guys. Please follow me on social media and subscribe to my channel, and also share this video. Have a good week, guys. Thanks a lot.